For the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. Does he agree with the Ministry of Health's annual report for the year ended June 2010 that states primary health care has failed to reduce admissions to hospitals compared with the base period ending September 2008?
Mr Speaker, on behalf of the Minister of Health, I can advise that the annual report details the number of ambulatory sensitive hospitalisations increased 3.2% in the year to March 2010. But that number needs to be seen in the context of the total change in the New Zealand population of 119,000 in the same period. When this is factored in, I'm advised that the rate of ambulatory sensitive hospitalisations has increased by only 0.03%. Ambulatory sensitive admissions are not solely determined by primary care, and they are just one indicator of the effectiveness of primary care.
Supplementary question, Mr Speaker. How many of the extra 2,000 avoidable and costly hospital admissions over the past year arose out of cuts to home care for the elderly who suffered falls, accidents and illness because help such as hanging out their washing and cleaning their toilet was taken away from them?
The Honourable Jonathan
On
Coleman.
behalf of the Minister of Health. Well, there could be a long debate about funding around home care, but the fact is all DHBs have received more money under this government and they are having to prioritise funding to the needs of the communities they serve.
Point of order, Mr Speaker.
Point of order.
Mr Speaker, my question was about the 2,000 avoidable hospital admissions and how many of them related to cuts to home care for elderly people.
But if the member recollects her question, she went on to describe all sorts of things about people hanging out washing. And the Minister's at liberty to pick up on that part of the question and dispute it, which he did. If the member has a further supplementary question, the Honourable Annette King.
Has he seen the information recently released by Capital and Coast District Health Board informing older people in the Mana electorate that they will no longer be eligible for home help after the 1st of December if their net income is over $399 a week? And if so, what is the expected rise in the avoidable hospital admissions from this decision and the cost to the taxpayer?
The Honourable Jonathan Coleman.
Well, I would have to check the assertions that member is making, but what I can tell her is that in this annual report, the Ministry of Health states that overall the state of public health results show continuing improvements in New Zealanders' health and independence, as well as ongoing improvements across a range of health and disability services and interventions. So basically, the state of the country's health is getting better under this government.
The Honourable Annette King.
Supplementary question, Mr Speaker. Does he believe the 88-year-old woman living alone with osteoporosis in the Mana electorate, living on $124 a week after she's paid for the basics like rent and food, is able to pay the $30 a week in home care, or is he unconcerned that if she can't cope, the taxpayer will be paying around $42,000 a year to keep her in a rest home? And how can that be best use of taxpayers' dollars, let alone humane, for this elderly woman?
On behalf of the Minister of Health. Well, once again, that member has brought a set of facts which may be open to some debate, but it sounds like an individual case, and if she'd like to bring that case before the Minister, we would be happy to discuss it.
The Honourable Annette King.
Supplementary question. Has he seen the Capital and Coast Child Report from July this year that cites children in the Porirua disproportionately suffering from dental caries, asthma, gastroenteritis, skin infections and pneumonia, and the solution proposed is to take even more funding off the elderly? And why should one vulnerable group in society be played off against another to meet his demands for efficiencies?
On behalf of the Minister of Health, what I can tell that member is that Capital and Coast has had an extra $57 million under this government over 2 years, and they are putting that money into the front line where it's needed most.
Michael Woodhouse. Point of order, I beg your pardon, the Honourable Pete Hodgson.
I should have perhaps waited till the question had finished, and I apologise to my Dunedin colleague. A pattern's emerged in health questions for the last year or two, and the essence of it is that the opposition says The point of order.
A point of order is being heard, and members must not interject. That was very disorderly, whoever did that. The Honourable Pete Hodgson.
The essence of it is that no matter what the opposition, I exaggerate a little for effect, but no matter what the opposition raises about this or that aspect of health delivery, the answer from the government is that there's more money going in than there ever was. Now, because in the history of New Zealand there's always more money going in than there ever was, that seems to me to not address the question according to 371A.
Order. I invite the member to reflect on the questions asked. The primary question referred to a report of the Ministry of Health, its annual report. Then supplementary questions bring up specific cases, claims about specific individuals that have not been validated, because there's no way to validate a supplementary question. And ministers cannot be expected to have information in their hands in the House to answer directly that sort of question. It seems not unreasonable when the question relates to the amount of money being spent for the minister to answer by saying, I do not have the information, but I'd be happy to look into that situation. But with respect to that DHB, X number of dollars more have been spent in that DHB. That seems a perfectly reasonable answer. If the members want to hear different answers, they need to think about the questions being asked.
Order, Mr. Speaker.
The Honourable Pete Hodgson.
I'll just do it. I promise to be my last go at this. The last question that was asked by the Honourable Annette King was not about an individual. It says, has the minister seen a report? The minister's answer is there's more money going into the DHB than there ever was. I don't think that's good enough.
Order. Well, I'll hear the Honourable Gerry Brownlee briefly, the Leader of the House.
Well, Mr. Speaker, you are increasingly being put into a position of having to rule from the chair about the content of both answers and questions, but more often it would seem answers. That's a completely debatable matter. It has not anything to do with order in the House, other than the fact that if we get into too bad a state, we get disorder. But merely calling for your ruling on the contents of a question is incredibly disrespectful to your role.
Order. No, I will not hear any more on this issue. It is not an issue as far as I'm concerned. I heard a question asked. I heard an answer given. I was perfectly satisfied with the answer given. Michael Woodhouse. Supplementary question.
Thank you, Mr. Speaker. Supplementary to the Minister of Health. What other recent reports from the Ministry of Health has he seen about access to hospital services?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health.
Order. Look, I apologise. Now, look, I've been pretty tough on the Government Ministers' Day in answering questions. I expect a little more respect out of the Labour front bench. The Minister hadn't opened his mouth and there was a barrage of interjections then. The Honourable Jonathan Coleman answering the question.
On behalf of the Minister of Health. I've seen a report released today about neurosurgical services for the South Island, and I note the outcome is quite different to all of the speculation that has been aired during years and years of uncertainty. The Acting Director-General of Health has announced that the South Island service will have 7 or 8 neurosurgeons, with at least 3 based in Dunedin, and it will include an academic focus. The decision on how South Island neurosurgical services will be configured shows the value of having clinicians finally involved in the planning of services.
Question number 5.